exposure of gluten in the mouth. And so I think it's first important to understand, a lot of people say, oh, come on, gluten causes damage everywhere, including the mouth. Come on, Dr. Osborne, you're trying to pull our leg. No, these are what I would call the vicious cycle, in a sense, of how unmanaged gluten sensitivity can actually contribute to damage to the mouth. So one of the ways that we can see unmanaged gluten sensitivity create damage in the mouth is through, and this is not always the case, but some people that get gluten issues vomit. They have projectile or cyclical vomiting. And remember, just like in anorexics or bulimics, when they binge and purge, that excessive vomit is very acidic, and it neutralizes and destroys the enamel on the teeth, setting the stage for a dry mouth, for redness, for chronic sore throat, and erosion, again, of that tooth enamel. So that's one mechanism, is just this vomiting component. You don't have to have vomiting. Maybe you're not dealing with the vomiting issue. For some people, it's not that obvious. It's more like a regurgitation. And so if you struggle with like heartburn, if you struggle with indigestion, gases and fluids coming up into the mouth because you deal with a lot of indigestion, this regurgitation can also contribute to these symptoms as well. Aside from these two, we know that gluten can alter the microbiome in the mouth as well. So it can change the nature. There have been a number of research studies that show that how gluten can change the nature of the types of bacteria that thrive and help your oral hygiene. And so the alteration of these different bacteria can also contribute to the dry mouth, the redness, as parts of the problem. Again, when you have this chronic dry mouth, understand, first of all, maybe it's a good idea to talk about, why is the mouth important in all this, aside from the obvious. So in your mouth, you've got your teeth, and what do your teeth do? They chew, right? And so what does that do? It breaks down food, so that it breaks it down mechanically so that it's easier for you to digest. Why is that important? We're after nutrients, right? I mean, otherwise, who needs teeth? Liquefy your food, you don't need them, right? This is one of the struggle as the elderly start to lose their teeth and have dentition issues from cavities or chronic oral tooth pain. They don't chew their food as well. They become more malnourished. So we get, with reduced food chewing comes reduced nutritional absorption, nutritional breakdown. So this is going to affect you for the rest of your life. So take care of your teeth today, and don't wait for them to start falling out to try to start taking care of them. So the mouth is very important, but also saliva. In your saliva, you produce antibodies that help protect you from environmental toxins that you bring into your mouth when you do eat. So antibodies like SIgA is an example. Secretory immunoglobulin A is a type of antibody that we produce. It's very beneficial for overall immune system function. But you also produce enzymes like amylase. Amylase in your mouth helps you digest carbohydrate. So your saliva is an important component from an antibody, from an amylase degradation of carbohydrates. The digestion begins in your mouth. So again, going back to this, so the reason why we break this down is because if gluten is creating dry mouth, right, and your saliva production is reduced, you could also potentially have a reduced antibody production along with lowered levels of amylase being secreted in your saliva to digest and break down your food, which again means what? Poor digestion. When you have poor digestion, we already know gluten by itself can cause damage to the stomach and the intestines, leading to poor digestion, but poor digestion can lead to that regurgitation, which then just kind of feeds this chronic cycle again, over and over and over again. So it's important to understand that gluten exposure, aside from vomiting, just the damage and the decay that it can do to the mouth through some of these mechanisms, very important. And then when that happens, we get worse nutrition, right? We get poor digestion, we get worse nutrition. So that means we're not getting adequate nutrients, okay, for good oral health. We're not getting what we need. What are those nutrients? We'll talk about those. Stick with me. We're going to talk about those at the end of the show. but it also increases the risk for tooth decay. So now we're losing our teeth, which again, chemically or mechanically help us to chew and break down that food, which can lead to poor digestion. So there's two ways we can have poor digestion. One is through chemical loss, right? Chemicals like the amylase help us break down our carbohydrates, chemically speaking, and then teeth mechanically, okay? So we've got, going back over here, when you're not digesting, when you're not absorbing nutrients as effectively and you're getting poor nutrition, your teeth begin to decay. When your teeth decay, it just basically cycles back up to this, right? And this creates issues with chewing and digestion, more malnutrition. It's a very, very vicious cycle that can occur. So again, we want to understand that gluten can do that. So if you're on the fence about whether or not you should be on a gluten-free diet, maybe you know you should be. Vanity sometimes helps people or encourages people to make better decisions. So if you're that type of person that's going to make a decision based on vanity, think about how you're going to look when your teeth decay and they're in pain and you end up with a mouthful of either dentures or a mouthful of implants or veneers or whatever else it might be. From a vanity perspective, that's not going to, people that have poor oral hygiene and bad teeth are generally just not attractive, and other people, that's going to affect your relationships. It's going to affect the way other people perceive you. That's just the world we live in. So don't get mad at me. Maybe use this as motivation to do the right thing and eat food that doesn't damage your oral cavity. Hey, don't forget to check out the rest of the series right here. Make sure you hit subscribe below. And as always, thanks for tuning in.